Plasma therapy. COVID-19 pandemic has posed challenges to governments, health professionals, and general public around the world. Many other countries, including India, are looking at plasma therapy as a potential option to treat this disease. Before moving further, let's understand about the stages of infection. The first stage is the attachment phase, in which some viruses gets attached to the epithelial cell of the host cell, or the target cell. After getting attached, the cell engulfs the virus by the process of endocytosis. This stage is known as the penetration stage. As the virus is engulfed completely by the cell, the virus starts releasing its contents inside the cell. This stage is known as uncoating. The released contents are the genetic material of the virus, that is, viral RNA. As the viral contents are released, they enter the nucleus of the host cell and start replicating, using viral RNA polymerase. This stage is known as biosynthesis. The viral proteins thus formed start assembling themselves. The last phase is the release phase. The new viral particles made are released in the extracellular fluid, while the cell, which is not killed in the process, continues to make new virus. Plasma. Blood plasma contributes to about 55% of total blood. It is a straw-colored liquid that remains when cells in it are removed by centrifugation. Constituents present in plasma are 90 to 92% water and 8 to 10% solutes. To know more about plasma and blood contents in detail, click the link above. People are usually confused about the difference between serum and plasma. The blood which is collected from a patient is centrifuged. It gives red blood cells, a buffy coat, or a barrier, and plasma. While if the clotting factors are removed from this plasma, it gives serum. Antibodies. These are large, Y-shaped proteins, produced by plasma cells, that are used by immune system to kill pathogens. B cells are a component of the immune system, as they secrete antibodies. These antibodies are loosely present in blood, or on the surface of B cells. The antibodies usually function in two ways. Either by blocking the ability of pathogen to infect the host cell, or by declining the ability of pathogens to infect. Convalescent person. A convalescent person is a patient who is gradually recovering health and strength after an illness. The people who recover from COVID-19 or any other disease have antibodies to the disease in their blood. Convalescent plasma therapy. This technique involves introduction of plasma, which is extracted from a convalescent person, into patients which are under treatment for the same disease. This technique was first used by Emil Von Behring. Along the history, this technique has been used during 1918 for Spanish flu, in 2009 for H1N1 flu. In 2014, WHO recommended the use of plasma therapy for Ebola virus. It was also used in 2015, that is during the spread of MERS virus. Now here is a simple flowchart to understand the procedure of plasma therapy. Once a person is infected with the virus, they undergo treatment. When the treatment procedures are successful, the patient recovers, as the patient's body starts secreting antibodies against the virus. This person is known as a convalescent person. Now a convalescent person donates blood. This blood is then checked for toxins, or any infection, and presence of appropriate number of antibodies. If the blood is found suitable, plasmapheresis is performed. Plasmapheresis is the extraction of plasma from blood. After completing the extraction process, the convalescent serum is injected in the body of a suffering patient. The countries which are using convalescent plasma therapy are China, South Korea, Italy, US, and Canada. In Shenzhen, China, Convalescent plasma therapy was used in a study, which found that the therapy was cleared and safe, for 7 out of 10 people. In India, ICMR Indian Council of Medical Research has allowed a use of plasma therapy for clinical trials, but not as a treatment option. Even though plasma therapy has shown positive results, there are some risks involved. First, convalescent plasma therapy provides maximum boost to immune, when administered in few days, or on onset of symptoms. If therapy is not performed with utmost care and precision, it might lead to transfer of other blood substances, which may lead to an accidental infection. It might enhance the previous infection for some patients, leading to an emergency situation. Plasma therapy might also suppress patient's natural immune system, leaving the patient vulnerable to reinfection. Convalescent plasma therapy is just a stopgap, until a vaccine or treatment is available. It is not validated for COVID-19, and cannot be deployed without caution.